Assalamu alaikum. I'm Hassan Hashim, 5th-year medical student, and I'm gonna explain this presentation as a group project for the elective course Basic Gynecological Endoscopy. In this presentation, we will explore laparoscopic ovarian cystectomy, a minimally invasive procedure used to manage adnexal masses. Our goal is to understand the benefits, indications, surgical techniques, and recovery associated with this approach. Let's start by defining the procedure. Laparoscopic ovarian cystectomy involves the removal of fluid-filled cysts from the ovary. The primary goal is to excise the pathology while preserving ovarian tissue and fertility. This method is the gold standard for managing benign ovarian cysts, and it offers both safety and efficiency. This procedure is typically indicated when cysts are symptomatic, causing pelvic pain or bloating. It's also recommended when cysts are larger than 5 to 6 centimeters or display suspicious features. Additionally, if there is risk of complications such as ovarian torsion, surgery is often necessary. Before surgery, a detailed diagnostic workup is essential. A transvaginal ultrasound is the first-line imaging technique to assess cyst size and structure. Tumor markers like CA125 help evaluate the risk of malignancy, and an MRI may be used for indeterminate cases to plan surgery. For the procedure, the patient is positioned in the dorsal lithotomy position with a Trendelenburg tilt to move the bowel away from the pelvis. General anesthesia is required for muscle relaxation, and the surgical team uses high-definition laparoscopic equipment and electrosurgery unit to ensure precision. The first step involves making an incision at the umbilicus to insert the camera port. Additional smaller ports are placed for instruments, ensuring proper triangulation to access the ovarian cyst effectively. Next, the ovary is stabilized and the cyst wall is gently separated from the ovarian tissue. The key technique here is the stripping method, where the cyst is carefully peeled away from the ovary while preserving as much healthy ovarian tissue as possible. After the cyst is detached, it's placed in a sterile retrieval bag to avoid spilling its contents, which could lead to complications like chemical peritonitis. The cyst is then carefully extracted through the umbilical incision. The major advantage of laparoscopic cystectomy is the reduced morbidity. Smaller incisions lead to less post-operative pain, quicker recovery, and minimal scarring. Patients often return to normal activities within a week or two, and the risk of adhesions is significantly lower. Although rare, complications can occur. These include bleeding, infection, and visceral injury, particularly during the initial laparoscopic entry. Additionally, excessive cauterization could impact ovarian function and could affect fertility. Post-surgery, patients typically experience mild discomfort and shoulder pain from gas, which is common but temporary. It's important to encourage walking soon after surgery to prevent clots. Wound care involves keeping the incision clean, and patients are monitored for any signs of infection or heavy bleeding. In conclusion, laparoscopic ovarian cystectomy is a highly effective and minimally invasive procedure. It offers several benefits over traditional open surgery, including faster recovery and less scarring. Thank you for your attention.